Good morning, everyone. Today, we're announcing the Southern District of Florida's results as part of the largest healthcare fraud takedown in American history. Nationwide, the Department of Justice charged 455 defendants responsible for more than $6.5 billion in fraud. Here in South Florida, we've charged 12 defendants involved in schemes targeting Medicare, Medicaid, private insurers, and other federal benefit programs. This historic operation reflects the leadership of President Donald J. Trump, Acting Attorney General Todd Blanche, and the Department of Justice in making fraud against the American taxpayer a top priority. It also reflects our strong partnership with Florida Attorney General James Uthmeier and the Florida Medicaid Fraud Control Unit. Healthcare fraud is not a victimless crime. Every fraudulent Medicare claim is money stolen from American seniors. Every dollar stolen is dollars taxpayers worked very hard for. For years, the federal government largely operated on a pay and chase model. Fraudsters billed Medicare, collected taxpayer dollars, and investigators tried to recoup the money later. That model has failed taxpayers. The operation and results announced this week show how we've moved from a detect and prevent strategy using advanced data analytics to identify suspicious billing before taxpayer dollars ever leave the Treasury. That measure of success is no longer how much fraud we prosecute after the fact. It's how much fraud we stop before a single taxpayer dollar is lost. Our objective is straightforward: stop the fraud, seize the proceeds, prosecute those responsible. We're indicting the fraudsters, we're identifying the criminal networks responsible, and just as importantly, we're taking back the money. Today, we're announcing the seizure of more than $27 million connected to fraudulent wound care clinics right here in South Florida. When we find the proceeds of fraud, we're seizing the bank accounts, the luxury cars, the jewelry, and the homes purchased with the stolen taxpayer dollars. Now, let me briefly walk you through today's cases. Here we have a cardiologist allegedly submitted $89 million in fraud claims for cardiovascular testing performed on student athletes, signing off on test results in seconds without meaningful review, even after being informed that one student later died from sudden cardiac arrest. This is very clear. This is not a victimless crime. You can see these fraud net. This particular testing site is affecting all over the country. And so we asked our citizens, our fellow Americans, we asked them to report any fraudulent testing sites they see to HHS. You can go to tips.hhs.gov. Here we have a convicted felon allegedly impersonating a deceased Miami doctor to fraudulently certify disability exemptions that allowed applicants to attain U.S. citizenship without completing required English and civics testing. Here again, we see crimes frequently intersect with other criminality. Allografts. This chart shows over the last 4 years, Medicare claims have shot up dramatically. As you can see here from 2020, 2021, less than $1 billion. And then we shoot up to 2025, $14.4 billion in claims for allografts. But what you see next is 2026, 6 months into the year, and we're not even at $0.1 billion. This is because we've changed the way we're doing business here in the federal government. This is under President Trump's leadership of detect and prevent, and we're seeing the numbers being dramatically brought down. So here we have a healthcare consultant allegedly set up a at least 11 fraudulent clinics that billed Medicare $117 million for wound care that was never provided. As you can see in this chart, these cases also show that the Department of Justice is working with our international partners so that we can hold these fraudsters accountable. We have a Miami businessman allegedly helped operate a sham durable medical equipment company is responsible for $3.76 billion in fraudulent claims and wired millions of dollars of fraud proceeds overseas. A Georgian national allegedly laundered proceeds from another international Medicare fraud scheme involving more than $1 billion in fraudulent billing. 3 defendants paid kickbacks to Medicaid beneficiaries and falsified attendance records at a Miami mental health clinic. A medical billing consultant allegedly submitted $58 million in fraudulent claims for medically unnecessary braces. Another billing company owner allegedly taught durable medical equipment companies how to avoid Medicare scrutiny while submitting more than $64 million in false claims. And I have a few more cases to cover. A call center owner allegedly generated $62 million in medically unnecessary genetic testing claims through deceptive telemarketing and kickback schemes. Another therapist allegedly directed patients to sign records for treatments that they never received. Finally, it's part as this week's takedown, the Southern District of Florida has seized over $27 million. What the public sees here is different schemes, but the same objective: to exploit our healthcare system and steal from American taxpayers. South Florida has long been the nation's leading target for healthcare fraud, but we are also home to some of the finest prosecutors, investigators, analysts, and agents anywhere in the country. I want to thank the prosecutors in our office, the department's healthcare fraud unit, the Florida Strike Force, the FBI, HHS-OIG, Homeland Security Investigations, USCIS, the Florida Medicaid Fraud Control Unit, IRS Criminal Investigation, DEA, the Office of Personnel Management, Inspector General, and all of our law enforcement partners who made today's work possible. I would now like to introduce one of those outstanding partners, FBI Miami Special Agent in Charge, Brett Skiles, whose agents played a critical role in these investigations.
Morning. So first, I'd like to thank our U.S. Attorney for the Southern District of Florida, Jason Reding Quiñones, for bringing us all together to highlight the pervasiveness and impact that healthcare fraud in South Florida has, and to recognize the 2 recent high-profile cases of our healthcare fraud program. Healthcare fraud is more than a financial crime. Every dollar stolen through healthcare fraud is a dollar derived from patient care, medical services, and programs that millions of Americans depend upon. The impact is felt not only in government-funded healthcare programs, but throughout the entire healthcare system. And certain factors such as a large elderly population and numerous healthcare providers and systems offer a target-rich environment for criminals to commit healthcare fraud in South Florida. For instance, in 2025, Florida was the first state in the U.S. with $10.3 billion with a B dollars billed to Medicare by durable medical equipment suppliers, almost twice as much as the next state. Analysts, investigators, and Medicare estimate that anywhere from 3 to 10% of that billing is fraudulent, meaning Florida's 2025 Medicare fraud estimates would range anywhere from over $300 million to $1 billion. Simply put, South Florida offers fraudsters an environment to exploit some of our most vulnerable populations, to include senior citizens, for financial gain. And over the years, FBI Miami and our partners have identified numerous healthcare fraud schemes ranging from durable medical equipment, telehealth, lab testing, treatment center, and education-based schemes. And there's always a commonality. Fraudsters are motivated by money. They exploit patients and deceive healthcare providers and programs at the expense of taxpayers, vulnerable individuals, and the integrity of our healthcare system. To combat these efforts, in 2007, FBI Miami, along with DOJ, formed the first healthcare fraud strike force, paving the way for a model that's been replicated in other strike force cities. The strike force is a force multiplier, establishing a collaborative effort for the FBI in Miami to collaborate not only with our partners, but on significant healthcare fraud investigations with partners such as SDFL, DOJ, HHS, DEA, and the VA, as well as state and local partners. So since its inception, the strike force contributions and impact on FBI investigations have been invaluable. And a perfect example is Operation Nightingale. The investigation uncovered a scheme to issue fake diplomas so students could obtain licenses and employment in the nursing field. Over 15,000 fake nursing diplomas were issued by 17 licensing nursing schools as well as underground schools for approximately $250 million in kickbacks. In June of 2026, after 2 weeks of trial, Carlene Norias pled guilty to 2 counts of conspiracy of wire fraud and money laundering for selling 2,600 fake nursing degrees over a 5-year period in Broward and Palm Beach counties, totaling $25 million in kickbacks. Norias' actions resulted in numerous instances of improper patient care, including a patient who died in a St. Louis hospital in 2023. Norias became the 43rd subject to be charged and ultimately convicted, in addition to $89 million in forfeiture money judgments and the recovery of $14 million in seizures. So to date, in 2026, FBI Miami's healthcare fraud investigations have resulted in the significant outcomes. $973 million in restitution ordered, $25.7 million in assets seized, 36 convictions, 68 sentencings totaling over 278 years, 16 indictments and 13 arrests. And in particular, I want to highlight 2 investigations for you this morning. The first, as was briefly mentioned by the U.S. Attorney, is on June 16th, Dr. Jason Finkelstein was indicted in the Southern District of Florida and arrested in Texas on June 18th for his role as a medical director of Capo Health, a private cardiovascular testing company in Boca Raton. The FBI received information alleging the owner, Mitchell Rubin, sonographers, and Finkelstein were knowingly conducting fraudulent testing on students. The company allegedly would bill private insurance companies for the testing without correct diagnosis on proper medical review for the testing. And from 2019 to 2025, Finkelstein was a provider and billed numerous plans, including the Veterans Affairs, Federal Employee Plan, and Medicaid for $89 million. He was paid over $13 million for fraudulent testing. The second case is a joint FBI investigation with our Department of Health and Human Services, OIG, and Office of Personnel Management partners, and the Sunshine Senior Solutions owner, Ibrahim Hilmi. The investigation revealed Medicare beneficiaries were billed for services, specifically unnecessary urinary catheters, glucose monitors, and wound care dressings that were never delivered to healthcare or Medicare beneficiaries. As the owner of Sunshine Senior Solutions, Hilmi billed $3.7 billion to Medicare and received almost $1.8 billion for this scheme. And in 2025, Hilmi fled the United States to Turkey before he could face justice. On June 11th, 2026, Hilmi was indicted in the Southern District of Florida. On June 18th, the FBI successfully planned and conducted a foreign transfer of custody, bringing Hilmi back to Miami. On Monday, June 22nd, Hilmi had his initial appearance in federal court. And these cases serve as a stark reminder to anyone who seeks ill-gotten gains through the healthcare fraud or through the healthcare fraud system. The FBI and our partners will aggressively investigate those who view healthcare programs as opportunities for personal enrichment while exploiting patients, providers, and taxpayers. The Miami Field Office is unwavering in its commitment to protecting the integrity of our nation's healthcare system for the millions of citizens who rely on healthcare programs on a daily basis. So I'll be followed by Isaac Bledsoe, Special Agent in charge of HHS.
Thank you. My name is Isaac Bledsoe. I'm the Special Agent in charge of HHS-OIG in the Miami Regional Office, which covers the entire state of Florida. I'd like to thank the U.S. Attorney and all of the other law enforcement and prosecutorial partners for having me here today. This year's National Healthcare Fraud Takedown reflects what really can be described and has already been described as a whole of government approach to protecting our federal healthcare programs and the beneficiaries who rely on them. The cases charged out of the Southern District of Florida specifically are the results of successful, ambitious enforcement operations which shut down a long string of alleged healthcare fraud schemes totaling over $4 billion. The cases charged nationwide, but specifically those here in the Southern District of Florida, demonstrate what is possible when law enforcement and our prosecutorial and federal healthcare partners work in true coordination to bring what we believe are those who we believe are responsible for these schemes to justice. The results you see here are the product of extensive collaboration, constant information sharing throughout the year, not only amongst the investigators and the prosecutors, but also with our program partners at the Centers for Medicare and Medicaid Services. This is my 16th year doing these takedowns with HHS-OIG. I can say for certain that healthcare fraud and the healthcare landscape evolves quickly, and those fraud schemes have become increasingly more sophisticated. To stay ahead of that, HHS-OIG and the work that we're doing in the Office of Investigations has taken advantage of cutting-edge data analytics tools that allow us to detect fraud schemes before they result in significant losses. We work closely with our data scientists and CMS, the Department of Justice, FBI, and all of our state and local partners to flag suspicious claims and place those suspected fraudulent companies and individuals on payment suspension. At times, so swiftly and so quickly that we're able to stop all but less than 1% of those monies and those payments of would-be fraudulent dollars of going out the door and from the Medicare and Medicaid Trust Fund. This is an example, as was mentioned before, of a move from the old pay and chase model to one of early detection and prevention. Even in those cases where money is paid and goes out the door, our unprecedented partnerships with financial institutions and banks allow us to all work together to quickly seize money and seize those dollars right out of the bad guy's bank account. So needless to say, all of us, this team you see here today, working together have created a proven playbook of recovering stolen funds, stolen taxpayer dollars, and these cases we're talking about exemplify that. Aside from the significant dollar amounts allegedly stolen in the schemes we have unveiled today, we also found evidence that those charged often exploited and harm patients who rely on federal healthcare programs to receive medically necessary and other needed services. These individuals were ignoring the real needs of these patients. These bad actors, some of them even physicians, medical professionals, allegedly billed for services that were never actually provided, services tainted by illegal kickbacks that corrupt impartial medical decision-making. And as we have seen and heard, these actions can in fact result in patients suffering physical harm and sometimes even death. So again, this is not a victimless crime. The future of healthcare fraud enforcement, as I see it, is proactive, it's data-informed, it's deeply collaborative. As you can see, no single agency can address these threats alone. We've built a great team together, federal law enforcement, state and local partners, CMS, and prosecutors across the Department of Justice. We can not only respond to this fraud in the future, but we can detect and prevent it before federal dollars are ever stolen and before patients are even put at risk. So again, I want to thank all of our partners, again, for the commitment to this mission. I want to thank the agents, the investigators, the analysts, and the prosecutors who got this work done. HHS will continue to work with each of them and each of you to safeguard our programs, protect our beneficiaries, and ensure that taxpayer funds are used for care and not for criminal profit. Thank you. With that, I'll pass it to Florida Attorney General.
Good morning, everybody. It's great to be here in Miami. How refreshing it is to have a federal government fighting for the American people, recouping billions in taxpayer dollars and putting bad guys away. Fighting fraud, saving taxpayer funds. It should be a bipartisan effort. It really should. And unfortunately, that just has not been the case. You're not going to fight fraud with an auto pen. You're going to do it with law enforcement, prosecutors, the best of forensic analysts and investigators. I got to say, it's just overwhelming how fired up our team has been at the state level to have such a great United States attorney, federal partners who want to put bad guys away. Here in Florida, we created a public assistance task force to support their efforts, working with our state and local law enforcement, our state agencies. We're prosecuting dozens of cases totaling tens of millions of dollars, just a fraction of the impressive figures they're looking at nationwide, and we will continue to do that. A few just random examples I pulled to show what's in it for you if you want to engage in this behavior. We recently took down Tamika Spears from Jacksonville, who owned True Care Health Services, a behavioral health company that was taking in tons of money from Medicaid. Turned out they weren't doing any work. Second, we've got Aline Sanchez from the Miami-Dade area. She was the sole owner of Beautiful Smiles Dental Clinic. Again, taking in Medicaid money. She was not even a licensed dentist. She's looking at almost 40 years in the Department of Corrections. Ms. Spears looking at almost 20 years in the Department of Corrections. In Volusia County, we just took down Vanessa Thomas. She was a mental health counselor who was supposed to be providing talk therapy. On many days, she was logging appointments with over 24 patients for hour-long appointments, logging more time than there is in the day. Obviously, that's not possible. Tons of fraud here. She's looking at over 90 years in the Department of Corrections. We're going to give her a nice scholarship here to our University of Corrections in Florida. There's also some real-life physical harms that come out of this. It's not just money. Just yesterday, we made 2 arrests. 2 individuals, Ronald Pack and Marie Karanan from Osceola and Polk counties. They were operating Cherish Home Care. This was an unlicensed fake nursing home. And as we saw them billing the federal government for services and continued to investigate, it turned out they were actually receiving patients. They were working with medical facilities and hospitals to transport outpatients into their facilities, where they would seize IDs, EBT cards, medications, and personal property, and they would impose house rules where they went so far as to put padlocks on doors to keep people locked up. There were reports of physical, sexual, and other abuses. Patients died likely because of their neglect. They're going to be looking at spending the rest of their time behind bars. Over 7 different charges being brought against them, ranging from public assistance fraud, exploitation, abuse, assault, neglect. We're going to make sure they don't see the light of day again. So what we're doing is not just saving taxpayer dollars, but it is saving lives. And I want to say it's a shame that there are jurisdictions and states out there that don't want to do this work. But here in the state of Florida, we believe in law and order. We will hold wrongdoers accountable. We will never be California or Minnesota. We will make sure if you break the law, you are going to do time, as much time as we can give you. So I want to thank the Trump administration, the United States Attorney, our federal partners. It's great to be getting this money back for the taxpayers. It's great to be putting bad guys away. And as long as we're in charge, we're going to keep doing it. God bless. Thank you.